Welcome to The Hidden Load, the podcast where we uncover the unseen weight carried by the educators and leaders in medicine and explore how to lighten it. I am Dr. Santina or Tina Wheat. I am a family physician, an educator, a leader, and a coach. Each week, we will dig into the challenges that often go unspoken, from burnout and boundaries to purpose and identity to figuring out sustainability, and share practical tools to help you move from chaos to calm and from burnout to balance. Because the hidden load does not have to be yours to carry alone, and in fact, shouldn't be. Let's get started.
This is episode 4, Self-Advocacy, Finding Your Voice in an Ever-Changing System. Now, if you have been following along, we have built a progression. In episode 1, we talked all about the hidden load and how it can lead to burnout. Then we moved on to episode 2. And in episode 2, we tackled balance and what it really should look like and how it's really a series of constant adjustments. And then we moved on to boundaries in episode 3. And we talked about how you can have boundaries without the guilt, and that this is a way to protect your energy and model for your team and your learners how this is really important as part of medicine. And today we are moving on to the next step. If you missed any of those episodes, I hope that you will go back and take a listen. But today we are taking the next step. And that is, how do we advocate for ourselves in this system that is constantly changing? Healthcare just seems to be constantly shifting. I am sure that I don't have to tell you how fast it's changing. There are new technologies. There are new documentation systems. There are new reimbursement models. There's new rules and expectations and guidelines, and the list just seems endless. And each of these things feels like they are changing on a daily basis. It feels like the rules are being rewritten every few months or even every few weeks. And somehow we are just expected to adapt without missing a beat. In the middle of all this change, it can feel risky to speak up for yourself, to ask for what you need, or to know when to say something isn't working, to be able to push back against the expectations that don't make sense or feel unrealistic. And we have to figure out how to do that in front of our learners and our teams. But here's the truth. If we don't learn to advocate for ourselves, then the system will not do it for us. It never will. So in this episode, we are going to explore a few things. The first is why self-advocacy feels so uncomfortable in healthcare. The second thing that we're going to explore is what happens when we actually don't speak up. And then the third thing that we're going to talk about is practical strategies to begin the advocacy in yourself in a way that feels professional, respectful, while also being effective. And just like in the last episode, I'm going to close with a reflection on why this matters, not just for you, but for the people who you lead and teach. So let's get started with why self-advocacy feels so hard. Now, let's be honest. Healthcare does not have the best track record of encouraging self-advocacy. One big reason that we see this is our training. From our earliest training, we are taught to put patients first. We're taught to put our learners first and the team first. The message is your needs come last. It might not be explicit, but it's one that we all hear. And it's a lesson that gets reinforced again and again. We normalize the skipping of meals, the missing of sleep, the ignoring our own health appointments, and the pushing through exhaustion. The list just goes on. And somewhere along the way, the message becomes your needs don't count. Now, I want to be honest. There are times when I think we do have to do some of those things, but I don't want anyone to walk away thinking that that is always the right answer. So when the idea of self-advocacy comes up, It might be asking for schedule flexibility. It might be requesting additional resources that you don't have. It might be setting limits on the amount of work that can be accomplished. It can just feel wrong. When you ask for those things, it feels like you're breaking this unwritten rule in medicine. You have to sacrifice yourself no matter the cost. This goes back to feeling uncomfortable putting ourselves before the needs of our patients, our learners, or our teams. And if we're honest with ourselves, there is also fear. There is fear that speaking up will make us look weak, lazy, or uncommitted. There is also a fear that it's going to hurt our reputation or our evaluation. That might even threaten our job security. So it's a real financial fear. And finally, there's the culture of silence. We see our colleagues struggling, but oftentimes they don't speak up. And that silence becomes contagious. We assume, well, if no one else is saying anything, then maybe I shouldn't either. And we might tell ourselves lots of stories about this. Maybe they're okay and they're worried about something else. So I need to just pretend that I'm okay too. Or maybe I'm actually not just good enough and I should be able to do these things that are expected of me. There are lots of different stories that we can tell ourselves. So it makes sense that self advocacy feels foreign and even uncomfortable. But the discomfort doesn't mean that it's wrong. It means that it's a muscle that we haven't used enough yet. It's a muscle that we have to strengthen. So I want to pause here and ask you, does that sound familiar? Have you ever bitten your tongue in a meeting, even when you had a valid concern? And maybe you bit your tongue because you didn't want to be that person. You didn't want to be the constant complainer. The hesitation that you felt is exactly why this topic matters. So let's think a little bit about the flip side. Let's talk about the cost of what happens when we don't advocate for ourselves. And I will add in for our learners or our teams. When we don't speak up, then we become invisible. The needs that we have, our own limits, even our ideas, they go unheard because we're not sharing them. The system assumes that everything is fine because there's no squeaky wheel, because we're silent. And so the workload keeps piling up. The expectations keep rising. The changes keep happening. And no one realizes how unsustainable it all is. In my experience, this has happened the most often when little things have been added incrementally. And you don't realize how much has been added until somebody else walks in and they're like, how much are you doing? So the second thing that happens when we don't speak up for ourselves or advocate for ourselves is that we become exhausted. Without that advocacy, we are always adjusting to fit the system. We are constantly changing ourselves, and change is hard. And that's instead of asking the system to adjust to reality. That constant adjustment is a recipe for burnout. The third thing, and this is important, is that our patients and our learners are affected too. A physician or a nurse who is stretched too thin is more prone to errors. They are less present with their patients and they are less effective as a teacher or a leader. A faculty member who is overcommitted has less time to mentor their learners. That silence doesn't just cost you, it ripples outwards. And one more cost. When we don't advocate for ourselves, we are unintentionally teaching others that they shouldn't be advocating for themselves either. I want you to think about your residents and your students and your junior colleagues. They are watching you at all times. If they never see you speak up or never hear about you speaking up, they learn that silence is the expectation. They learn that silence is the only way to survive in healthcare and that you should just keep your head down. We end up carrying these unsustainable workloads and agreeing to changes that we just don't understand. and we end up absorbing more and more tasks until we are running on fumes. And eventually, that running on fumes, it leads to burnout, to turnover, and even leaving the profession altogether. So again, when we don't model for our learners how to speak up for ourselves, we are passing on to a whole generation of healthcare professionals that their needs don't matter. Is that the legacy that we want to leave? We will have a whole generation who believe that asking for help or requesting resources or saying this isn't sustainable is somehow a show of weakness. Of course, we don't want that. So let's talk about how we can do this differently. How do we begin to practice self-advocacy in ways that are mindful of our needs to take care of others and also effective? Here are 5 strategies that can help. The first is to start with clarity. It is hard to advocate if you're not even sure what it is that need. It is hard to advocate for yourself if you are not even sure what it is that you need. So take the time to reflect. What is it that is the true pain point? What is it that would make the biggest difference for you right in this moment? What is it that would make the biggest difference for you right in this moment? Maybe it's schedule flexibility. Maybe it's administrative support. Maybe it's a different clinical schedule. Maybe it's protected teaching time. The clearer you are, the easier it is to ask. And when you actually have a solution, it's easier too. The second strategy is to frame it in terms of a shared goal. Self-advocacy does not mean that you are only looking out for yourself. Some of the most effective requests are when you are able to connect them to the mission. So, for example, if I have protected time for this, then I can deliver a higher quality curriculum for the learners. Or maybe if our team had administrative support, we would have more time for direct patient care. This strategy shifts the ask from me to we. Strategy number 3 is to use professional language. This should not just be about venting or complaining. It is clear, respectful communication. The second is to use appropriate language. This is not about complaining. This is about clear and respectful communication. It should not just be a vent session. A few phrases that you might want to try are, in order to meet this expectation, here is what I would need to be successful. Or you might try, I want to be sure that I'm contributing effectively. And for that, I will need. And even a third option is, can we please explore a solution that supports both patient care and sustainability for our physicians, our nurses, whomever you are talking about? The fourth strategy is to start small. You do not have to change everything overnight. And you might even discover that by changing one small thing, you don't need to change everything. So pick one thing. Maybe it's asking for a different meeting time so that it doesn't cut into clinic. Or maybe you're going to request one afternoon a month of protected teaching preparatory time. When you can see that advocacy can work, your confidence in this muscle of self-advocacy will also grow. And then the fifth strategy is to find allies. You don't have to do this alone. Often, others are struggling with the same challenges. So sometimes talking with others can help you find a better solution. And also, a collective voice is more powerful than an individual voice. That might mean a group of faculty who are raising a concern together, or it might be residents approaching leadership as a team. So I want to pause here and invite you to reflect. Think about your own role right now. Is there one place where you have been holding back from advocating for yourself? What is stopping you from that advocacy? And what would it look like if you were to take a small step this week? With that in mind, I want to provide a reframe for you to hold on to. Self-advocacy is not selfish, even though self is in the title. Self-advocacy is about stewardship. It is how we steward our time, our skills, and our energy so that we can keep doing the work that we love, not just for the next week, but for the long haul. And I want to push that a step further, especially for those of us in education and leadership. Self-advocacy is also an important skill to model. When you use your voice, you are not only protecting yourself, you are teaching others through your example that their voices matter too. Think about your residents or your students or your junior colleagues. They are all watching you closely. If they see you speak up for protected time or clarify limits around the workload or ask for reasonable expectations or the resources that you need, they are learning an important lesson. It is okay to do that. It is part of being a professional. If they never see us advocate for what we need for ourselves, what do they learn instead? They learn that silence is the expectation. They learn that good doctors, good nurses, good educators just absorb everything, even when it's unsustainable. They learn that their voice doesn't belong in the system. And eventually, many of them will burn out before their careers even truly begin. But when we model self-advocacy, we are able to normalize it. We show the next generation that you can be an excellent clinician and have a say in how you practice. You can be a dedicated teacher and ask for the resources that you need to be successful and sustainable. You can be a strong leader and also set limits on what seems realistic. That is powerful. That is culture shaping. So here's the reframe in just one sentence. Advocating for yourself is one of the most important ways that you advocate for your learners and your colleagues. Because when you model it, you are not just protecting your own well-being, you are building a culture where the people around you and the people coming after you believe that their voices are important and belong to. So today, we talked about self-advocacy, why it feels so uncomfortable, what happens when we don't use our voice, and how to start building the skill of advocacy in small, concrete ways. Remember, advocating for yourself doesn't mean you are being selfish. It means that you are invested in your well-being, in your patients, and in the future of healthcare. And as leaders and educators, when we model this, we are not just protecting ourselves. We are showing the next generation that their voices matter too. Thank you so much for spending time with me in episode 4, Self-Advocacy, Finding a Voice in a Changing System. If today's conversation resonated with you, then I would love for you to do 3 quick things. Number 1, go subscribe or follow the show. That way you'll never miss an episode. Number 2, leave a rating or a review. It helps other educators and leaders in medicine find this podcast. And it also reminds me that these conversations matter. And number 3, share this episode with a colleague who might need to hear that what they are carrying is not theirs alone. Because the truth is, holding everyone else up does not mean losing yourself. And in our next episode, we are going to shift to the practice of reflection. Why it often feels awkward or forced, at least that's what I used to think, and how to make it an authentic, powerful tool for growth as both a professional and a leader. And until then, remember, your voice has value. Using it isn't just about your own survival. It is about shaping a healthier and more sustainable culture for all of us. Thanks for listening and for choosing to find your voice in a system that needs it now more than ever.
Thanks for joining me on The Hidden Load. Tag me on Instagram at Dr. Tina Wheat or email me at santina@santinawheat.com with your takeaways and ideas. Don't forget to subscribe, and until next time, let's lighten your hidden load.